This week marks 5 years since the World Health Organization declared COVID-19 a pandemic. Doctors and nurses were called to the front lines while schools and businesses were forced to go on lockdown. And wearing a mask became necessary. WCNC Charlotte anchor Lisa Washington had the chance to sit down with an atrium nurse reflecting on her experience.
Katie Blackwell didn't grow up thinking she would be a nurse.
Nursing is my second career. I managed an art supply store, actually a couple different ones.
But she says she needed a more steady career, especially since she wanted a family.
So I was like, nutrition, that sounds great. I knew nothing about nutrition. But in those classes were a bunch of nursing students because they're all the same prerequisites. And I was so jealous of all the stuff that they were telling me about. And I was like, you do that in nursing? That's what a nurse does? I thought that we just took blood pressures.
She's now been with Atrium Health for 11 years. Before COVID,
I started out on a cardiac tele floor, and then quickly moved to ICU, and I've been in ICU since.
During
COVID, that was a very exhausting job because it was a lot of patients that needed that level of help.
And now on the other side,
we were very, very cautious in everything that we did. So it added a lot more steps for safety, which decreased some of the things that we didn't have to do.
But not everyone stayed. According to the National Council of State Boards of Nursing, approximately 100,000 registered nurses left the workforce during the first 2 years of the COVID-19 pandemic due to stress, burnout, and retirements.
Blackwell says she never considered it.
I didn't even consider not going in the next day. I often wanted to go in extra because they needed it.
But Blackwell says she understands why some people did leave.
None of it is a selfish reason. It was because their families needed them in a different way, or they had to move somewhere else, or maybe there was something that was going on in their family, because so many people were very sick at that time, including healthcare workers and their families.
The National Council of State Boards of Nursing also found another 610,000 nurses report an intent to leave the workforce by 2027 due to stress, burnout, and retirement. Blackwell encourages people to stay, even if it's shifting your role.
No matter what your passion is, you will find a place in the nursing field. You can do policy or informatics, you can do technology stuff, you can do virtual, you can work with any demographic, you can work remotely. Nursing is the backbone of healthcare.
Blackwell adds that even during the hard times, the patients are worth it.
This gentleman came back after he was able to walk and talk, and we were like, you look like a completely different person. And it was so heartwarming and also really shocking because I hadn't thought about how far a patient can heal from the time that they're with us.
Blackwell says one thing that really changed during the pandemic was the technology that was available for them. Coming up at 5, Vanessa Rufus takes a closer look at how telehealth has evolved since COVID and what could be the next innovation with this form of healthcare.